Bismillahirrahmanirrahim. Respected Mustafa Kamal Sahab, Federal Minister of Health of Pakistan, we are very specially thankful to you for making it possible. Mr. Hassan Khan, Chancellor, Riphah International University, Dr. Shagufta Feroz, I call her the Columbus of lifestyle medicine in Pakistan, General 𝐂𝐨𝐧𝐿𝐴𝐧𝐿𝐴𝐧𝐿 Saqib Sahab, Dean, Faculty of Health Sciences, Riphah International University, our guests from abroad, from inland, students, researchers, teachers, ladies and gentlemen, very warm welcome to this 6th International Lifestyle Conference and Retreat. We are very thankful for your presence. Let me begin by saying that at this stage in my life, at the twilight of my professional career, I decided to become part of this growing movement of lifestyle medicine in Pakistan for a reason. And I'll explain you that reason in a minute. But let me share just one bit with you, which is shocking. Pakistan today houses the 3rd largest population in the world suffering from type 2 diabetes, only second to China and India. 33 million people, 33 मिलियन लोग जो कि 3 करोड़ और 30 लाख लोग बनते हैं, they are suffering from type 2 diabetes. This is a public health crisis. No other word can be used but that it is a public health crisis in Pakistan. And this is one disease. If you talk about cardiovascular diseases, if you talk about cancers, if you talk about kidney function diseases, if you talk about liver function diseases, if you talk about various other chronic diseases, Pakistan is under a very high burden of disease because of all of these problems. As part of the study which is happening right now, and it is going to be published very soon, we are looking at the burden of disease and its analysis in Pakistan. Just to give you an idea, only 20 years ago, diabetes in the ranking of diseases in Pakistan was on 22nd ranking. And last year, it has jumped up to the 3rd most important disease, which is afflicting Pakistanis. So this is the kind of context within which we talk about promoting, supporting, adopting lifestyle medicine. When I left government, I thought that I will just do things that interest me in my private life. But 2 very important things happened since I have left the government. The first is that I was invited in October last year to the same very conference in the same very venue, which was the 5th International Conference on Lifestyle Medicine. And I was first time exposed to the science, and I repeat, science, it is not just rhetoric, evidence base of lifestyle medicine globally. I was little skeptical, to be honest, in the beginning. But I read about it, I got convinced about it, and perhaps, Mustafa Kamal sir, about Pakistan I'm sure, but maybe globally, I'm the only health minister who, after leaving the health ministry, did his post-graduation in lifestyle medicine. I spent 6 months with Dr. Shagufta Feroz and her team, and I realized the power, the rationale, and the substance which lifestyle medicine brings. The second very important thing which happened was that I was convinced, and I was easily convinced, I must say, that I should stand for the elections of the Pakistan Association for Lifestyle Medicine as its president. And I decided to do that. I decided to do that not just to become the president, but with a mission. Because I think that people like myself who are privileged, people like Mustafa Kamal Saab, people like all of you who are sitting here as responsible, thinking, concerned citizens of Pakistan, they need to play their role in terms of turning the tide of non-communicable diseases in Pakistan. And that's why I stood for elections and I got elected as president of the Pakistan Association for Lifestyle Medicine. So this is a mission. I will take this opportunity also to congratulate my cabinet members who have been elected here. I was telling somebody jokingly that this was one of the most free and fair election which took place. And a comment came, and I will not say who commented this. He said, "Jo jeet jate hain, wo free and fair hi kehte hain." But nevertheless, it was actually a model of also a professional organization of doctors conducting this election digitally. And I think, Dr. Shagufta, we need to write about it. We need to create also a model, and maybe our politicians will also learn from it, that how a fair and free election can take place. I will very quickly, using the presence of Mustafa Kamal Saab, because I think it is also very important that I elaborate a little bit that how we are connected. I read few of his statements when he took over as the Federal Health Minister, and I was very impressed. Time and again, you come across people who are non-health professionals, but who get the gist of the spirit of the public health crisis in Pakistan. He's one of those people. Because in his early speeches, he started talking about, very early on, he started talking about the inability of the healthcare system of Pakistan to address the problems of healthcare system in Pakistan. This is so wise and so courageous for a federal health minister to say this. This means that you are sticking your neck out with your colleagues in the cabinet and in front of the Prime Minister that your healthcare system cannot address your problems. I thank you very much for saying this. And then he also started emphasizing the importance of prevention and the importance of changing the way we have set up our healthcare system, being, although we call it healthcare system, but basically it is a system for the care of sick, not for the healthy people. The word health and its definition by World Health Organization includes that health is not just absence of disease. Sir, ये बड़ा important नुक्ता है. Health is not just absence of disease. It is a state of physical, mental, and social well-being. That's the philosophy, and that's the gist of any healthcare system, how it should be. Now, I will like to share with you that the mission that I refer to as mission of the Pakistan Association for Lifestyle Medicine, which works, by the way, very closely with the Riphah Institute of Lifestyle Medicine, which is also the first institute on lifestyle medicine in Pakistan. And thank you very much, Hassan Saab, for doing that. I would like to now share with you a few slides in which I would like to share the vision and the plan, not just vision, but the plan for implementation in next 3 years, as long as I hold this office of being president of this association, that what we would like to see change in the country. And you heard Dr. 𝐂𝐨𝐧𝐿𝐿, who is the president of the PMDC. I'm very thankful to him that he gave us blank check. He said that whatever recommendations come out of this conference, he would be very willing to work with us to change whatever needs to be changed and improve whatever needs to be improved. So the vision and plan is, let me read this out to you because each word is very carefully put here. So the vision for Pakistan Association for Lifestyle Medicine is that we want to see lifestyle medicine formally, officially integrated in medical education and training of health professionals. And I'm saying health professionals. Health profession and healthcare system is not the monopoly of the doctors only, which we tend to think. There are more than 30 types of allied health professionals, and we completely ignore them in our arrogance, I would say. We do not pay enough attention to the nurses and to the medical technicians and to the lab assistants and so on. So, health professionals, lifestyle medicine is formally integrated in medical education and training of our health professionals, and it is integral part of our healthcare delivery system at community level, at primary healthcare level, at secondary and tertiary and population levels in both public and private sector. Because private sector is a bigger sector in healthcare system of Pakistan than the public sector. But again, when we use the word policy and when we use the word national in Pakistan, we actually mean public sector. We very conveniently exclude the private health sector because we don't know much about it. Or sometimes we are scared to touch it. Or sometimes we cannot regulate it. But if we are serious and sincere about improving and upgrading the healthcare system in Pakistan, we have to think comprehensively about public and private health sector. And is established and we want to see lifestyle medicine established as a specialty with appropriately trained practitioners at the postgraduate level, including through College of Physicians and Surgeons of Pakistan. So this is the vision, and rest is just a strategy that how we are going to translate this vision into a implementable plan, and we will all work for its implementation. Next slide, please. Basically, we are talking about two things because they are at the root. ये बुनियाद हैं, ये फाउंडेशन हैं. अगर ये हम दो चीज़ें कर लें तो आने वाले वक्तों में जब हम में से बहुत सारे लोग यहाँ पे मौजूद नहीं भी होंगे, तो आपका हेल्थ केयर सिस्टम इन प्रिंसिपल्स के ऊपर फर्दर बिल्ड होगा, इम्प्रूव होगा और आगे चलेगा. One is integrating lifestyle medicine in medical education and training. And second, integrating lifestyle medicine in the healthcare system. पहले आपको अपनी हेल्थ वर्क फोर्स को ओरिएंट करना है अबाउट लाइफस्टाइल मेडिसिन, और फिर आपने अपने हेल्थ केयर सिस्टम में इंटीग्रेट करना है लाइफस्टाइल इंटरवेंशंस को. नेक्स्ट, ये हमारे 6 ऑब्जेक्टिव्स हैं. मैं एक एक ऑब्जेक्टिव को आपको अगली स्लाइड्स के अंदर एक्सप्लेन करूंगा, बजाय ये मैं सारे रीड आउट करूँ. नेक्स्ट प्लीज. सबसे पहले तो ये कि ये विजन जो आपके सामने मैंने पेश की, this vision is going to be turned into a strategy. After this conference, our cabinet and many other friends of lifestyle medicine are going to sit down and really work the nitty-gritty of it, that how in next 3 years, what actions will be taken, by what timeline, by whom, and what changes will be brought. Next. Secondly, we have to, and some of colleagues are already working on it, and it is almost ready, Mustafa Kamal Sahab, the reforms which needs to be taken up at the undergraduate level of medical education for integrating the aspects of the lifestyle medicine into it. ये हम सबमिट करेंगे PMDC को, उनसे इसको क्लियर करवाएंगे उनकी कमेटी से, एंड इट विल बिकम an obligation, not an option, an obligation for all 185 medical institutions in the country to actually teach to their students the lifestyle medicine. Next. And at the postgraduate level, this was undergraduate level, at the postgraduate level, we want to initiate officially recognized diploma in lifestyle medicine as well as a master's level program in lifestyle medicine. Again, this work has started. We will be completing this work. In our strategy, we have timeline that by this end of the, this actually we will be doing inshallah by 2027. We will have whole curriculum. It will be officially endorsed by the relevant regulatory institutions in the country, and it will be implemented. Next. On allied health professionals, actually my dream is that all allied health professionals must be learning about lifestyle medicine. Only then they can contribute, they can advise the patients, and even they can assist the doctors in a right way. So at least 3 packages will be developed for allied health professionals, but maybe more, and it's an ongoing work. Next. The 5th objective is that we need to expand the membership of the Pakistan Association for Lifestyle Medicine. मुस्तफ़ा साहब, हमारे यहाँ प्रोफेशनल लोगों की जो ऑर्गेनाइजेशंस हैं पाकिस्तान में, वो छोटे छोटे माफियाज हैं. एक्चुअली they are interest groups. They only they raise money in case of health professionals associations. They raise money from the pharmaceutical companies by sitting in their pockets, by advancing their agendas, and then it is sheer politics. सदर कौन बनेगा, जनरल सेक्रेटरी कौन बनेगा, हम बाहर के ट्रिप्स पे के कब जाएंगे, और हम कॉन्फ्रेंसेस कौन सी करेंगे, और वगैरह वगैरह. मैं आपको एक मिसाल देना चाहता हूँ. वन ऑफ द मोस्ट prestigious peer-reviewed journal in medical science is British Medical Journal. Very few of us recognize this. Who produced British Medical Journal? It is British Medical Association which produced British Medical Journal with cutting-edge research on medical sciences. Almost every doctor take pride in this, that they are members of the British Medical Association. Why can't we have such professional associations in Pakistan? My dream is, Dr. Shagufta, मैं ये आपको एक declaration दे रहा हूँ कि Pakistan Association for lifestyle medicine will be such association which will be most credible, which will be most looked up to, and which will serve as a model for other health professional associations in Pakistan. We can become easily a accrediting body for lifestyle medicine practice in Pakistan, for example. Why not? If JCI can actually become a gold standard for accreditation of hospitals, being a professionals association, ये NGO है कनाडा के अंदर जो आपके डॉक्टर, जो आपके हॉस्पिटल्स को accredit करती है around the world. Why can't we take that paradigm about health professionals association and take pride in it, rather than becoming छोटी-छोटी fiefdoms जिसके लिए लोग लड़ते मरते रहते हैं. And we are going to, my dream is that as many members of the PMDC should be as many members of the Pakistan Association for Lifestyle Medicine. Next. And of course, we will hold and continue to hold these congregations of practitioners, health professionals, and in next 3 years, we'll be holding, inshallah, 3 more international conferences. Our Dr. Shagufta Feroz is very well linked with the international movement of lifestyle medicine. She's highly regarded globally. She has taken the association to a level where among, I think, 33 or 32 national associations globally is recognized. One of them is Pakistan Association for Lifestyle Medicine, which is recognized globally today. And we will take it to the next level, because it is at level 3. We will actually make it the par excellence association representing lifestyle medicine in Pakistan. Next. Inshallah. Thank you very much for your attention.